Okay, so good afternoon, everybody. And this afternoon, I'm going to try and finish off our discussion about diseases caused by viruses. Remembering that all that we're doing is we're just skittering along the surface, talking about some of the most important ones to us at the moment. Remember that there are many, many hundreds of different disease conditions caused by viruses. So here's a group of viruses, which I'm sure that you've heard about. And these are the herpes viruses. And the herpes viruses are enveloped animal viruses, which are a double-stranded DNA virus. So from the outside, actually, it would look really something like the COVID virus or an enveloped virus, with an envelope derived from the host membranes, and that membrane studded with viral proteins, which determine its ability to bind to specific cells. So the herpes viruses tend to be rather specific, rather host specific. There are many, many, many herpes viruses. It's a huge group, and they are recorded in many different animal groups, but they do tend to be rather host specific. So the ones we're going to talk about today actually are specific to human beings. And the first group, a group that you've probably heard the most about, which are the Herpes Simplex viruses. Now, the Herpes Simplex viruses are this group that cause a variety of different diseases in humans. But they have some common characteristics. The ones that you're probably most aware of, I've mentioned before, the Herpes Simplex 1, often abbreviated HSV. So HSV1 is the strain of Herpes Simplex virus, which causes oral lesions. And those oral lesions have this one characteristic, which is true for most herpes viruses. And that is that an initial exposure produces an acute infection. And that acute infection may then resolve, and the virus is able to remain latent. And they tend to do this by integrating that DNA genome with the host genome in specific cells. And in this group, in the two groups that we're going to talk about in the most detail, the Herpes Simplex viruses and the varicella viruses, that integration is into nerve cells. And they don't actually affect the functioning of the nerve cells all that much. But they remain latent in the nerve cells, and they can then erupt at a later stage. They become active. It is somewhat analogous to that lytic, lysogenic lifestyle change that we saw in the bacteriophages. But here it's taking place in humans. The viral genome integrates with the human genome in specific cells, remains quiet, and then under certain circumstances, which are very often quite unclear, the virus may activate and cause actual symptoms of disease, usually by inducing the production of some sort of skin eruption in both of these groups, in both the simplex viruses and the varicella zoster viruses. So herpes simplex 1 is the virus which causes the simple cold sores, which we get around our mouths and sometimes nostrils on the face. And when these occur, what has happened is that the virus emerges from nerve endings close to the surface of the skin, and it causes disease in the skin cells themselves. It causes blisters and blistering of the skin, and at the same time can be intensely painful because the nerve endings are damaged and the nerve endings become exposed as well because of the erosion. At that stage, you produce kind of an exudate very often. There's a clear serum like fluid, scabbing, etc., which is very rich in virus. So at that stage, during eruption, the person becomes very infectious. But for the rest of the time, they're not actually infectious. While the virus is latent, the person is not infectious. So that is herpes simplex 1. Herpes simplex 2 is the virus which causes genital herpes. And genital herpes behaves, it's a different strain of the same group. It behaves somewhat differently, and it has a preference for the genital regions, both in male and in female. And it actually inhabits nerves around the genital region, but penetrating all the way up to the back, to the sacrum. And during an eruption, especially early eruptions of the virus, during early acute episodes, the person may not only have blisters on the genitals, but may also have blisters in the small of the back, right down at the bottom, at the sacrum. And genital herpes, of course, causes enormous anxiety, about which I'll have something to say. So first of all, these both herpes simplex, oral herpes simplex, and the genital herpes are actually somewhat interchangeable. You can, in fact, acquire genital herpes strain, simplex 2, around the mouth from, say, from oral sex, for example. You can likewise, you can acquire herpes simplex 1 in the genital region, but they don't tend to persist. They definitely have a preference for the types of cells and the environment that they prefer. In both cases, what is often found is that after initial infection, there may be initial symptoms. There may be very lengthy periods when the virus is completely silent. And in the case of both oral and genital herpes, it may very often, after 1 or 2 episodes, goes completely silent and never reappears. The exact environmental cues that cause an outbreak are not known. There's certainly something in the organismal environment that does it. Cold sores, people often associate with cold, with having been exposed to cold. May well be, maybe the oral mucosa gets stressed or something like this. Genital herpes is very unclear, but the major danger with genital herpes, first of all, let me make it clear, in males, the presence of an outbreak of genital herpes is very, very obvious. It causes intense pain in penis, and it causes intensely painful urination very often. And there's nothing that sends people to the doctor quicker than painful urination. So in men, it's very often pretty obvious that they are having an outbreak. The danger is in the women, it may not be so obvious. The outbreak may take place high in the vagina, for example, and not be noticed beyond maybe some irritation and discharge. It is true that in genital herpes, it does then retreat and go silent, but you cannot actually really cure the infection, although there are definitely medications which you can take during an outbreak to limit the length of the outbreak. And if you take them very, very early on, you can curtail an outbreak. The problem with outbreaks is not only that they're uncomfortable or whatever, but that those are the periods when you become infectious and you can infect a partner. But especially in the case of women, you can also infect a child. And this is why it's very, very important, if you have had an outbreak, ever had an outbreak of genital herpes, and you are pregnant and have a child, it's very, very important to make the attending medical staff aware of the fact that you have had a previous outbreak. Both so you can be examined to see whether it's a current outbreak, and there are tests that can be done, but also so that you can be given prophylactic treatment. And the danger is that if you give birth to a child by vaginal birth, the child is exposed to, can be exposed to virus if you have active lesions in the vagina. And it produces can produce very, very serious consequences for the child, amongst which are an infection of the corneas, the keratitis of the corneas, but also it can spread to the systemic illness in some cases. So it can be extremely dangerous. But there are definitely prophylactic measures that can be taken to ensure a safe birth. So it's not the end of the world. If you have acquired genital herpes, it's very definitely not the end of the world. It is something that you need just to be aware of and stay on top of. The second group of herpes viruses that we need to talk about are these. These are they're actually quite closely related to the simplex viruses, but they are the varicella zoster viruses. Now, the most important of the varicella zoster viruses in human beings is the virus which causes the disease chickenpox in children. And I've mentioned this before. Here is another of these herpes viruses, which after an initial bout of chickenpox, say as a child, the virus becomes latent. Chickenpox is a systemic illness. When you suffer from the disease, it's throughout the body, but it tends to retreat to certain specific groups of nerves, blocks of nerves in actual fact. And one set is in the face, either side, and the other set are on the trunk, and usually upper chest, and then the midriff especially. And these can remain silent for your entire life. In many people, they do. They never reappear. But it is possible, especially later in life, perhaps as your immune system begins to lose some efficiency, that they can erupt and produce an intensely painful, debilitating disease called shingles. If you can imagine cold sores spread in a huge band on the trunk or down the face, with the whole thing being intensely sensitive, blistering, and very, very sensitive, very, very painful. That is much what shingles is like. People describe it as feeling like they were burned by a blowtorch. Intensely painful, and in the very elderly, it can be so painful it can cause shock, can send the patient into shock. You know what I forgot to do? I forgot. Oh no, it's all right. I didn't forget. I thought for a minute that I'd forgotten to record this. Thank goodness. Any case, so here are just some pictures. These are the cold sores. The typical cold sore. Many of you have had it. Some of you may have not. Though I have never had a cold sore. But that is genetic. Okay, that is. It seems that there is a genetic component, but cold sores are incredibly common. But some people just never suffer from these things. It's genetic, probably genetically determined. The virus simply can't get a hold. So the reactivation, yeah, as I say, we don't really know. Here's a typical case of genital herpes. This is in a male, fairly obviously. And this is herpes simplex virus 2, but don't forget, similar symptoms can be produced by herpes simplex 1, although in the genital region, they don't tend to reoccur. It tends to be a one-off. In males, it's very easy to see. In females, not nearly as easy. I mentioned the neonatal herpes, the herpes keratitis on the cornea, but the other thing that it can cause is neurological, and unsurprisingly, because we've already heard it can infect the nerves. But in infants, it can cause severe neurological deficits as well. So that is very serious. So this is chickenpox here. This is typical chickenpox, and it tends to be a childhood illness. Chickenpox is actually a very serious illness. People tend to like downplay it, say, oh, it's just a childhood illness. There's nothing like just a childhood illness. Childhood illnesses like this carry with them a significant morbidity and significant mortality as well, and very often can have serious sequelae for somebody that has suffered from it, quite apart from the fact that you've acquired the virus and may get shingles later on. So chickenpox used to be extremely common and, in fact, quite a high cause of mortality in children and infants. It produces a widespread fever, first of all, and widespread rash over the body of these pustules with little pussy outbreaks. It's very, very easily transmitted. It's highly communicable. And when I was a child, when a child in school had chickenpox, it ran rampant through the school, but mainly because all the parents would get together and send their kids for a chickenpox party, so that everybody would get infected all at once and get it over and done with, and then hopefully be immune. But that common practice had serious consequences, because several of the children would always become extremely ill and often, suffer long-term illness as well. And it's also, unfortunately, the other thing that happens is with it, these pustules are intensely itchy. So children scratch, and the common thing was to wrap children's hands in cloth to stop them scratching, because they expose themselves to severe bacterial infections very often as a result. These pustules last quite a long time, and the itching certainly lasts a long time. But there is a very good vaccine. There are actually several kinds of vaccine now available. And as a result, chickenpox become really uncommon, except, as I've mentioned several times, the anti-vaccine movement has led to a resurgence of chickenpox in several places, not only in the United States, but in Europe and other places as well. It's a very, very, very safe vaccine. So there's really the risk of anything the risks associated with vaccine. There are risks, very definitely, there always are. The risk associated with the vaccine is far, far, far lower than the risk of serious consequence of acquiring the illness. So here is shingles, and this is typical shingles rash. Very, very, very sensitive to the touch or to movement, even to air movement, people complain about. The duration of a shingles outbreak varies, and unfortunately, a single shingles outbreak often is precursor to recurrent outbreaks. And but there are very good anti-shingles vaccines which can be taken at any time during life, and there are sort of treatments which can try to limit the length of the outbreak. It's not a cure, but can try to limit the length of the outbreaks. There's sometimes some quite serious consequences to a shingles outbreak, and one of them is that it can produce a persistent neuralgia, persistent activation of pain nerve endings, which it can become extremely, extremely debilitating. This chronic, constant pain becomes extremely debilitating in some people, not in everyone. That's a typical. Now, this is what I meant by a block of nerve endings. This is an entire segment here, which has been derived in development of the fetus, of a whole lot of associated nerves, and the virus tends to occupy one of these entire blocks, and in a shingles outbreak appear throughout that entire block. As I say, sometimes in the face or in segments down the rest of the trunk. Now the last, let me just flip back here. We're going to just skip over a couple. I will just let me just do this one first. This is Kaposi's sarcoma-like virus, and I'm only mentioning it because we are going to actually see it again. And this is Kaposi's sarcoma is actually a very, very rare cancer, like a tumor, produced by a viral infection. This is one of the viruses that can transform, in this case, the skin cells to produce these lesions. Now, under normal circumstances, this is an extremely rare cancer. And it actually appears in a specific ethnic group particularly, and that is in very elderly Ashkenazi Jewish men. That is the group in which it is most commonly seen. And it never kills any of them. It's a very slow growing, rather benign kind of tumor. It's actually not a benign tumor. It is a malignant tumor, but it spreads extremely slowly and it grows extremely slowly in these elderly men. However, in immunocompromised people, it becomes extremely aggressive, as shown here, and spreads from the skin into vital organs like the lungs and the liver and the brain as well. And it is the appearance of this rare cancer in young, healthy, gay men, which was one of the heralds of the AIDS epidemic in the 1980s, because they suddenly started seeing this rare disease in young men who were not even Jewish, young men of all ethnic backgrounds who had immune systems which were collapsing due to human immunodeficiency virus, were presenting with this very rare cancer. And it's a typical example. When the immune system collapses, these strange infections, which have been completely silenced, never made an appearance at all and never would normally make an appearance. Once the immune system collapses, they become extremely dangerous. So this is Kaposi's sarcoma. I'm just going to mention, as we pass, one last group of the herpes viruses, and these are the Epstein-Barr viruses. It's actually a big group, and there are several of them that cause a widely disparate kind of diseases, but one of them you may have heard of, and that is mononucleosis, which is in high school commonly called kissing disease. Very benign, self-limiting disease, commonly spread in adolescence. They say it's through kissing, or maybe, I don't know, it's probably aerosol spread rather. But in any case, I mention that because some of you may have had it, but this is one which usually does not make its appearance again. Once you've had it, you tend to be immune. But there are other Epstein-Barr, but not the same as mononucleosis, but there are other Epstein-Barr viruses which are extremely interesting because they're implicated in several different cancers. And so these are probably oncogenic viruses. And several of the Epstein-Barr viruses are implicated, especially in a group of cancers called the sarcomas. They're a very big, very interesting group. Okay, so we'll just talk about a couple of the other diseases that primarily manifest as diseases of the skin. Here's one of the most dangerous of all of the childhood illnesses, and that is measles. And this is a group of viruses called paramyxa viruses, and they cause a group of the different childhood illnesses. Probably the most dangerous of all of those is this disease, measles, which is also known as rubeola. And rubeola is, or measles, is transmitted through aerosol droplets, but it is one of the most highly contagious of all of the viral diseases. It spreads extremely easily, and it is quite persistent in the environment. So is very easy to acquire. It produces a high fever, which in itself can be extremely dangerous, if not fatal. And it produces a wide variety of systemic effects, including impacts on the lungs, heart function, and all sorts of things if it is very serious. Its primary presentation is this very obvious rash that arises, and those are the measles. Measles refers to those red dots. But there are also, I don't know if you can see inside here, these white patches on the mucosa inside the mouth and down the throat. These are also diagnostic, and these are called Cochlear Spots. So the first thing about measles is that it is a very serious illness for a child, and it has a high mortality rate compared to most of the other childhood diseases. In addition, it can produce serious sequelae, including effects on the eyes, the heart, all sorts of things as well. So it is really not something to mess around with. There is a very, very good vaccine. There have been very good vaccines available for a long time. And it is usually given together in this vaccination here, the MMR. And this is the measles, mumps, and rubella inoculation. We're going to hear about each of those diseases as well, but of all of them, measles is the most serious and carries the greatest potential for really serious sequelae. One of the impacts of the measles we have heard about before, and that is, this is one of these viruses which rarely, but with predictable occurrence, with predictable incidence, does not actually die out entirely in some people. So when they get it, the child gets it, they maintain the effect in infection at an extremely low rate, very, very low level of infection for a very long time as a chronic infection. And the impact begins to accumulate, and the impact is primarily neurological. And it produces this extremely serious disease called subacute. Subacute because it's below the level of obvious illness for much of its occurrence. Subacute sclerosing panencephalitis. The sclerosis is actually damage to the nerves themselves. It's actually damage to the nerve shafts, to the nerve fibers. And it is a fatal illness. Once symptoms begin to appear, it has a very, very, very poor outcome, and usually in late teens and early 20s. So it is a tragic outcome of the occurrence of measles, and reason enough to get the vaccine. The other, it also causes a disease called Paget's disease, which is somewhat less serious than subacute sclerosing panencephalitis. I haven't put it up here, but you can, if you're interested, look up the impact of vaccination on the incidence of both measles and SSP, subacute sclerosing panencephalitis. And you can see that over the years, the occurrence of both, the incidence of both, has plummeted in the United States and in Europe, but unfortunately is increasing again because of anti-vaccine activities. So I'll just mention here, I'm not going to go political on you. This measles, mumps, and rubella vaccine, there has been an enormous amount of research done on this topic. And I will tell you right now that not one reputable study has shown any association between the MMR vaccine and autism, nor any other childhood neurological deficit. There is no evidence, none, to associate this vaccine with those impacts on children. Nonetheless, misinformation continues to be spread about this vaccination. And many parents just feel, well, I won't take the risk. Well, in doing so, and in being willing to expose their children to measles, just quite apart from mumps and rubella, which we'll talk about in a minute, but especially to measles, they're exposing them to an enormously higher risk of poor outcome than taking the vaccine. This, for a start, the disease itself in childhood can be extremely serious, and the sequelae can be even worse. This is not something that anybody wants to see their child live through for years and years and then die off. And so it's in considering, if you have your own children and you're considering the whole issue, please read up all of the studies, which millions upon millions of dollars have been wasted proving over and over and over and over again there is no association between this vaccine and childhood neurological illness. None. Here's the next disease that's included in that vaccine. This is mumps. It's called infectious parotitis. Parotitis because of this. This is because it infects these parotid glands here in the neck, which are your salivary glands, part of your salivary complex. And this causes blockage of the ducts, and the saliva just builds up, and the gland becomes inflamed and sore, and the neck swells in this way to produce this typical symptom of mumps. So it's quite easily spread. It has a much lower morbidity and much, much lower mortality than measles. It does have some associated more serious morbidity and mortality in children, but it's much, much lower. It tends to be fairly well tolerated and usually pretty well overcome in children. So I say in children because in adults, it can be extremely serious. And this is one good reason for getting the vaccine. The vaccine is very long lasting, and you can actually have a booster later on in life if you want to. So the problem with this virus, in children, it just tends to do this. It is a systemic illness, but this is its major impact, is this swelling and uncomfortable swelling and sore throat. But in adults, it tends to have wider spread impacts. And in males, the most spectacular is an inflammation of the testes. And the testes can swell to an enormous size, despite the fact that they are surrounded by a very dense connective tissue coating. So they are effectively developing pressure against this, and it can cause disruption of the testicular tissues, which are very, very highly organized to produce sperm. And it can affect fertility. Most people, even if they have this condition, inflammation of the testes is called orchitis. Even if they have severe orchitis, it doesn't have a major impact on their later fertility. Often it's only in one testicle, not in the other. But even if it is in both, most people, they maintain their fertility, but it can affect the fertility. It is extremely painful. Associated with that, in adults, however, there's very often a very high fever, and it can also produce other impacts. It can infect the pancreas and cause pancreatitis and diabetes, secondary diabetes, because of the impact on the pancreas. It can also cause encephalitis and has been known to be fatal as encephalitis. So in adults can be very serious. In women, it can also infect the ovaries and cause an ovaritis, but that has little impact on fertility and is also much less painful. The ovary is not surrounded by such a dense connective tissue coating as the testis, so it can swell up even more easily without bad impact. There can be other, women can get pancreatitis as well. Again, it's prevented by the MMR vaccine, which is extremely long-lived, and also can be boosted later on in life if you're concerned. If, for instance, you've been exposed to mumps, or you are likely to be exposed to mumps, you can't remember whether you had it or whether you were vaccinated, you can get a vaccine even as an adult. Now, the last one is rubella, included in that vaccine, MMR, measles, mumps, rubella. Rubella used also to be called German measles. And it tends to be a very mild, short-lived acute infection in children. They may have a temperature, often they don't. This is one of the dangers of the disease. It's very easily spread because often children don't even feel particularly ill. And the most obvious sign is a rash. That's often the first and only thing that's noticed about it, and they spread the virus very easily. In children, the recovery is usually rapid, but they can suffer several relapses. But that is not the big problem with rubella. The problem is that women who are pregnant, who acquire the virus, are in grave danger of impacting the fetus. Depends on the timing of it, but especially if they have rubella early on in the pregnancy, they can be born, the child can be born with major problems, eyes, ears, heart, and even limb development. So this is extremely serious, and an infection in women may pass without her even knowing that she's had it. This is one of the major reasons that it was included in this vaccine, in the MMR vaccine, was to reduce the overall incidence in the population so that pregnant women would not be exposed. And since the widespread use of MMR, these impacts on pregnant women have virtually been eliminated. Another good reason to get your children vaccinated and make sure that you're vaccinated, because we have responsibility to people that we don't even know. We can be spreading illness without even knowing it, and it can have a far greater impact on them than it had on us. Okay, so here are a couple of others. These are all kind of skin-related things. This is one you'll know well. I've mentioned it before. This is human papilloma virus. This is a group of viruses. They're different viral strains. And one of them is causes these common warts. Very, very common, even in adults, but more common in children. These warts tend to be self-limiting. Even an individual wart has a certain lifespan, and then it disappears. You get another wart somewhere else. And often after puberty, they become less and less common. May pop up every now and again, even in adulthood. They can be transmitted from person to person, and they can also be transmitted from one area of skin to another. So if you have warts, it's a good idea to observe good hygiene in dealing with them. And of course, common warts are very easily treated if you wish to do so. Over-the-counter medications do work. They work slowly. All that they do, there's usually salicylic acid, which is basically aspirin, a solution of aspirin, which actually causes the death of a lot of this tissue, and it causes the host tissues that the virus might affect to become kind of inhospitable. And eventually you wipe the virus out enough that your immune system is able to deal with the rest of it and clean up the tissue, and you get rid of the wart. You can also have them burned off with liquid nitrogen, which works well, but often the doctor will tell you, you get them burned off, and they'll tell you, right, will you carry on now for another couple of weeks, putting on salicylic acid just to make sure. They're relatively easily dealt with. The danger comes in an incredibly common condition, which is genital warts. And genital warts actually they're basically exactly the same as common warts, but a different strain that seems to have a preference for genital tissue. And these are called Condylomata. And they form large, often, and very unsightly warts in both men and women. And they, first of all, they do very definitely affect sexual function. They are unpleasant. They bleed easily as well. And so their occurrence usually does send somebody off to the doctor to have them treated. And they are, in fact, relatively easily treated, especially with liquid nitrogen freezing. So and if need be, if they're very, very large, with surgery. But they are relatively easily dealt with. And also they do, in fact, tend to be self-limiting, but the difficulties they cause while they're there will most often send the person off to the doctor. So that is their first thing. They're a nuisance. But the problem is that they cause long-term effects. This is another of these viruses which appears able to transform normal cells and make them become cancerous. This is much more common in women than it is in men, but these papilloma viruses are incredibly common. Most people who have been sexually active and had more than one partner, or whose partner has had more than one partner, will have been exposed to papilloma viruses. So an infection with papilloma virus does not necessarily cause warts, does not necessarily cause the symptoms that would drive you to a doctor to have them frozen off. The infection may, in fact, be silent. And in women, it is a primary cause of cervical cancer. And in men, it is a primary cause of penile cancers. Now, in men, that penile cancer is much less common than cervical cancer is in women. It's rather rare, but the cause is usually a papillomavirus. Now, I put here this vaccine Gardasil. The Gardasil was one of the early vaccines. Still get it. It's still a good vaccine, but there are even newer vaccines that you can get. And there are, I believe now, vaccines that you can have even if you're an adult, which may protect you even if you have been infected. You might want to check up on that. But this vaccine Gardasil and others, it is advised that they be given to children before puberty, and that they're usually given in 2 doses. So the child receives a fairly high immune response, produces a relatively high immune response well before they actually become sexually active. Because the assumption is as soon as they become sexually active, you should assume that as soon as they become sexually active, they are going to be exposed. It is that common in the population. Unfortunately, again, there is a group of people who have worked really hard to stop the use of this vaccine because they claim that it is encouraging promiscuity in teenagers, etc., and that rather people should commit to monogamy. Given all of human history, I'm afraid that is already a lost cause. If you want to adopt that strategy for yourself, that is absolutely fine. Just make sure that your partner has never had a sexual encounter, and that you haven't had a sexual encounter, and then it might work. But for much of the population, this vaccine given well in advance of the big start of sexual activity works extremely well, and it has been shown to work very well through studies of, for example, of cervical cancers. Here, this is an Australian study. This is the normal rate or incidence of cervical cancer in the population. This is where the vaccination HPV vaccination programs began, and these are the rates for cervical cancers, which have plummeted as a result. Unfortunately, these studies have carried on, and they have examined areas where, especially in the southern states of the United States, for example, where there's been strenuous activity to stop the use of the vaccine, and there they are seeing an uptick in cervical cancers in 20-year-old, 25, 35-year-old women who could have received the vaccine and did not as teenagers. It's very sad, a sad consequence. Okay, so I now want to also spend some time talking to you about a human immunodeficiency virus and the disease of AIDS. And I want to do so because you have, all of you, grown up in an era where, in fact, probably shortly after you were born, very, very good treatments for this disease and for dealing with the virus were developed. And most of you have not lived through the time, the Great Plague, which struck us before COVID, I suppose we could put it that way, but with much more serious consequences, even though the incidence was much lower than that of COVID. And this was the AIDS epidemic, which began actually in the late 70s, but was not really documented until the early 1980s. And this is a very strange virus. This is the human immunodeficiency virus, or HIV. And I want you to go back to the chart of all of the viral types, and you'll see that HIV is actually an RNA virus. And but it behaves in a very strange way. You'll remember that the RNA viruses had all of these strategies for getting their genome up and running in the host cell. Well, the HIV has a particularly strange way of doing that, and that is that it converts its RNA strand, which is a positive RNA strand, to DNA. Now, you remember that when we talked about transcription and translation, and even transcription is the process of taking DNA and producing RNA from it, a messenger RNA strand. Well, HIV has a positive RNA strand. It's just like a messenger RNA strand, but it also has its own specialized polymerase, which is called reverse transcriptase. And it's reverse transcriptase because it reads the messenger RNA strand, which is the genome of HIV. And from that, it produces DNA. It's not reading DNA and producing RNA. It's reading RNA and it's producing DNA. And that DNA strand is then integrated into the host genome. It's a very strange strategy. So inside the virus, as we'll see in a minute, it has its own, some of its own enzymes together with its genome. On the outside of the virus, it has a set of spikes. Looks rather like the COVID virus. It is enveloped, and then it has spikes. There are two kinds. They're called Gp120 and Gp41. And one is responsible for attachment, and then the other one is responsible for actually fusing to the host cell. So with that introduction, I'll show you here. Here's the virus, the viral particle. This is the virion, the equivalent of, remember, a virion is the equivalent of a viral cell. Here's the virion, here's the envelope here. You can see all the spikes on the Gp120, Gp41. These have to bind to specific protein receptors on the surface of the cell, and only certain cells have them. So HIV is first of all a human virus. It doesn't infect anything else and cause disease. is specific for humans, but it is specific for a group of cells which have these proteins. One of them is called CD4, the other CCR5. And these are on the outside, and this is what the proteins here bind to. So they bind here, and they open up. Remember what we saw this once before. They are not taken in by endocytosis. Instead, they unify with the host membrane and spit the capsid into the cell. Inside the capsid, if you look carefully, you'll see they have two strands of RNA. They have a duplicate genome, two identical strands of RNA. They are positive RNA strands. And in addition, they have their own polymerase, which is reverse transcriptase. As soon as they spit that in, the reverse transcriptase produces first a single and then a double strand of DNA. And this double strand DNA is imported into the nucleus of the cell and is integrated into the host genome, where it forms, we've heard this word before, it forms a provirus. Now the cells which it infects, the most abundant and most important group of cells that it infects are members of the immune system, and especially a group of cells called the helper T cells. It is the role of helper T cells to talk to other cells in the immune system and tell and effectively interact with them to produce antibody. We're not going to discuss all of the ins and outs of the immune system, but that is effectively what they do. They interact with other members of the immune system and direct the formation of antibody to specific pathogens and antigens and everything else. So let's just say this is actually a T cell, a helper T cell. It's been infected with HIV, and initially it's not affected at all. Initially, in actual fact, it may be completely unaffected by this process because the virus remains completely silent as a provirus. But if this T cell becomes active, if this T cell is activated by having to interact, say, with a pathogen, as soon as it becomes active, what happens in the T cell is it begins to clone itself. It starts to produce massive and massive copies of itself. And when it does so, it produces massive copies, of course, of the virus, provirus as well. And this provirus now becomes activated. And the provirus begins to read off viral RNAs. It forces the host cell to begin transcribing the viral genes. It produces viral RNA, and it produces a whole group of substances which are exported from the nucleus. It exports, first of all, copies of its genome, which are going to be incorporated into new particles here. It also exports messenger RNA, which are going to be translated by the cell, by the host cell, and are going to produce all of the viral proteins. And those viral proteins are going to be assembled first into a capsid. Then this viral genome is going to be incorporated into the capsid. And then the whole lot, the capsid, buds out. All of these viral proteins here become embedded in the host membrane, and the whole thing buds out to produce the new viral particles. This continues for some time in the cell, in these cells. And as it does so, gradually, more and more and more, the normal functions of the cell become impaired until eventually the cell dies. But it can continue budding out these new virions for a long time. A single cell can bud out hundreds of viral particles like this before it actually dies. So now the virus begins to spread through the whole body, and the viral count begins to rise. More cells become infected. More cells produce more viral particles. More of the immune system begins to decline until eventually the immune system itself begins to fail. In the meantime, of course, the person is infectious. They may remain uninfectious as long as they don't have viral particles circulating. But as soon as they have viral particles circulating, which I'll show you is actually very soon, they become infectious. HIV is not, by the way, very, very infectious. You need to acquire it under very specific circumstances of great intimacy. And those must involve the exchange of body fluid, either body fluid through sex or through things like exchanging blood. Either sharing needles in blood and drug exchange, or in a blood exchange system, like a blood transfusion service. So we recognize, let me just go here because it's easier to explain here, and then I'll go back to that. It has, HIV infection has a very strange course. It's unusual, actually, for most viruses. And it's a reflection of its strange interaction with the immune system. It's one of the few viruses that interacts directly with the immune system and has its major impact on the immune system. It's not its only impact, as I'll mention again if I remember. But let's have a look here. This here, the red line, is the viral load that person has once they're infected. This here is actually a measure of the immune function. And it is, in fact, the number of cells present in circulating the body, which are CD4 positive. In other words, those cells, like the T helper cells, that bear the receptor for the virus. But it's also a measure, it's a proxy measure for the functioning of the immune system. Because these cells are central to the immune system. You lose the function of these cells, you lose the function of the immune system. So here's the course of the events. This person has not been exposed previously. And as they, I'm just trying to think ahead of what I put this absolutely clearly. So they haven't been exposed. Now they get exposed to the virus. And actually, the initial infection is an acute infection. When they're first infected, the body has very little defenses against the virus. And there's an initial period where the person may, in fact, within 10 days or so, become incredibly ill. Usually this manifests itself as almost, sometimes people think they have severe mononucleosis or a very bad flu or something like that, often a very high temperature, rigor, shaking, general debility, blinding headaches, etc., etc. This is a time when people actually are carrying the highest load that they will carry until their immune system actually collapses completely. Something very strange happens. And that is the initial response of the immune system is just like it would be to any normal viral infection. The body produces masses of antibodies. It very quickly learns that there's this virus circulating, produces masses of antibodies. And initially, the amount of virus present in the body plummets, but it does not go to zero. It just drops much lower than it was here. Now the virus seems to retreat. This is a period when it is silent inside these CD4 cells. But gradually, as those CD4 cells one by one get activated, as they're called into action, against other pathogens and everything. As they get activated, they begin to produce viral particles and they begin to die off themselves. So what we see, have a look here, and you'll see that in the initial infection, CD4 cells drop drastically, but they very soon recover. Now we begin the slow period of immune decline, of immune illness and immune decline. And look what happens to the CD4 cells. They drop over time. They drop lower and lower and lower. The normal count is around about 1,200 CD4 cells per microliter of plasma. They drop and drop and drop until they reach this point here, around about 200 cells per microliter. That is the clinical definition of AIDS, and it is at this point that the immune system actually begins to collapse completely. At this level, the immune system is having great trouble working at all. And it's here, at this break point, that a person would be diagnosed as suffering from the disease of AIDS, acquired immune deficiency syndrome. And with the collapse of the immune system, with the loss of all control over the virus count begins to shoot up very, very, very high. So there's some really important things to notice about this. And the first thing I'll say, notice that there is no scale down here, because this timeline here varies tremendously. In some people, this is a year or 18 months. In other people, this is 10 to 15 years before they see these major effects. That is probably genetically determined, but it may also be determined by the strain of virus. This is a very, very mutable virus. There are many, many, many different substrains of this virus which behave somewhat differently to one another, some of them much more virulent than others. The second thing, notice that until we get to this point here, when the immune system collapses completely and the virus just takes off wildly, the most infectious time for the person is right here, right when they have first been infected. They may actually be feeling better here and go out on the town because they're feeling better, but they have incredibly high viral loads. Notice also that as these CD4 counts drop, the function of the immune system is getting progressively worse and worse and worse. So as it starts to decline, this person is going to start seeing various things happening. They may be having night sweats. They may be having the odd fungal infection that they just cannot get rid of. Then another fungal infection. When they get to this stage here, they often are reporting, if they have not ever been tested, they're often reporting here because they've got a sudden catastrophic pneumonia, and the doctor will find that it's from some weird organism that normally doesn't infect human beings. When its immune function is lost here, the body loses its ability to fight off all sorts of things which normally we would not even notice. And even even organisms which are part of our normal microflora might suddenly become pathogenic because our whole immune system has been changed. If we were to follow the antibody level against HIV, however, we would find that this person had high anti-HIV antibodies all the way up until about here, when the immune system itself begins to crash and they lose the ability to produce any antibodies anyway. This is because this virus is incredibly mutable. It mutates very, very quickly. The body initially sees the virus and produces antibody to it. And when we can carry on measuring that antibody virtually until the person dies, but the antibody that the person is producing is completely ineffective against the virus. We know that because you can see the population of virus increasing here. When a person says that they are HIV positive, That means that they have gone and they have been tested for the presence of antibodies to HIV. But because they are producing antibody to HIV does not mean to say that they are overcoming the illness. They are not. It simply records the fact they have been infected and they produced an initial burst of antibody. They may continue to produce antibody, but it is ineffective. The virus continually evades antibody activity. It is able to evade the body's defense system and carry on killing off the immune system. It's an insidious and very, very dangerous disease. So I'm not going to run through the whole list of diseases associated with the collapse of the immune system, but you can see that there are many, many, many different things which normally would cause us no problem at all. Some of them I have mentioned. There are things, for example, people often begin to suffer from recurrent shingles. Well, an ordinary person can also suffer from shingles, but they don't suffer from it as a constant chronic infection usually, unless something's wrong with their immune system. There are many early infections like herpes simplex infections, which a person had not seen for 20, 30 years, suddenly become active. Why? Because the immune system is collapsing and these things are now escaping. They start to suffer from weird, strange bacterial diseases, which normally they would not suffer from. This, for example, Mycobacterium avium. This is a Mycobacterium. And Mycobacteria, don't forget, are the things like tuberculosis. Mycobacterium avium. This is actually its name tells you it's normally found in birds. We're exposed to it the whole time, but our immune systems immediately kill it off. We never have to, if you've got a normal immune system, you never have to worry about Mycobacterium avium. But people without an immune system, this is extremely serious, and it causes brain lesions and all sorts of terrible things. All sorts of strange fungal diseases. This is probably the most important, Pneumocystis Pneumonia, because this was the very first disease which alerted epidemiologists to the fact that the AIDS epidemic had begun. It was the occurrence of Pneumocystis Pneumonia in young, healthy men, which alerted the CDC to the fact that a new epidemic was beginning. And this was detailed in a mortality and morbidity report by the CDC. And worldwide, it was the first acknowledgement, although they didn't know the cause and everything else. It was the first acknowledgement that a new syndrome had arisen. And in that case, in the United States, it had centered itself on the gay population. So it was young gay men who were presenting. And these were extremely young, fit young men. So it is extremely unusual. This is what caught everybody's attention. The terrible thing was that people died very, very quickly of these diseases. Without an immune system, without treatment, very often something like pneumocystis killed people very, very quickly. So all of these, here's the other one, the other keynote symptom was the presentation of Kaposi sarcoma. There it is there. But there were numerous other rare cancers which were associated with it. So I'll just tell you, first of all, for many, many years, those of us who lived through that terrible epidemic and saw that people who were diagnosed, especially people who were symptomatic, very, very rapidly became extremely ill and died. It was, for many years, it was a death sentence. And that was a terrible, terrible thing to live through. But through it, we also learned the enormous power that comes from community. That's the first thing that needs to be said. But the second thing is the enormous power of ordinary, common sense information put out in a simple and clear manner, and the impact that changes in behavior can have on the spread of a disease. To simple things like telling people that the routes of infection were through body fluid, so through especially through semen, through vaginal secretions as well, but much less than through semen, and then through blood, exchange of blood products, either through drug use, sharing needles, etc., or through established blood transfusion services. As soon as that was realized, people could adapt their behavior. So, for example, the importance, the continued importance, even now, of emphasizing to people the importance of protecting yourself during sexual contact, wearing condoms, all of these kind of limiting partners. All of these strategies work. They worked. They reduced the incidence of infection by HIV long before we had any available treatment. Going out into drug-using communities, needle-using communities, and emphasizing the importance of using clean needles, not sharing, making apparatus available so that people didn't have to share syringes, etc. All of these things had huge impact. These were common sense things which actually you didn't need to be a doctor or an epidemiologist to devise. You just had to know something about the way in which this disease was being propagated and the way it worked in the human body. Initially, the only way to test for the disease itself was to test for antibodies. And this is still done, and it's done through serological testing, usually through this process called ELISA. So, but there are now very, very sensitive ways of testing for the actual presence of the virus in circulation in body fluid. And this is to look for the viral RNA. And to measure the viral RNA, you can actually measure very, very accurately what viral load people are carrying. So it's not only telling them, okay, you're HIV positive, but we can say this is your current viral load. And now, of course, we have ways of treating. So initially, there was no treatment for 5-6 years of the epidemic. There was absolutely none. Everybody who got it died. And it was a very terrible and a very frightening time. But then the first drugs did become available. The first one is called azidothymidine. So let me just go back actually to this diagram, and I'll explain some of the strategies here. The first successful group of drugs were these. This was azidothymidine, or AZT, and its relatives. And what they did was they interfered with this. They interfered with the ability of reverse transcriptase to produce this DNA strand. So this, what was discovered was AZT, and there are some compounds which are related, when first used, it did have an effect. It did slow down the disease, the progress of disease. And it was soon discovered, it very definitely seemed to have an impact in preventing the acquisition of these. Say somebody had a sexual encounter and the person had said, I'm HIV negative, and they had unprotected sex. And then the person called them and said, I'm terribly sorry, but I just found out I was positive. That was a kind of situation where immediate use of AZT could actually have a prophylactic effect. It would stop the person from becoming infected, even if they became exposed. And AZT continues to be used in that fashion under various circumstances. If people have been accidentally exposed, medical personnel who have had an accidental needle prick, for example, pregnant women who are HIV positive can take AZT to prevent transmission to their infants. There are various circumstances under which AZT is used. And unfortunately, well, I want to say unfortunately without explaining, AZT's great disadvantage. First of all, AZT does have side effects, especially if it's taken over a long period of time. But second of all, this virus, I've told you, is very, very mutable rather. It changes very, very easily, and it very, very quickly evades the impact of AZT. It very soon becomes resistant to AZT. People who were taking it in the early days, hoping to prolong their lives only by months before the virus evaded the AZT. But AZT continues to be used, is used in under prophylaxis, the circumstances as I described, but it's also used in developing countries where nothing else is available. So it continues to be used. But it was very soon realized it had very limited promise. So now there was very little to be used until this group of drugs was developed, which operate right here. Now, to explain to you, this viral RNA here, it's like a messenger RNA, and it's being exported out of the cell, and is then being read off, and it's being translated by the ribosomes of the host cell. And the ribosomes actually produce one single long protein, polypeptide strand. The virus, not included in this diagram, is the fact that the virus also pumps into the cell its own proteases. These are enzymes which cut that long strand of protein at specific places into specific lengths, which get processed into viral protein. So we produce one long viral protein polypeptide strand. The viral proteases cut that into appropriate lengths, and those go to form all of these proteins here, the viral proteins. Well, we fortunately found this group of substances which stop the activity of the proteases. They are called the protease inhibitors, and they prevent this from happening. And they work extremely, extremely well. During the AIDS epidemic, it was really like a miracle. I saw people who I knew I was not going to see the next week, who were literally at death's door, recover within days, begin to recover within days of beginning protease inhibitor treatment. It is a very, very effective treatment. It has a problem, and was already realized that resistance needed to be looked out for. So there are a number of these protease inhibitors, and they can be swapped in and out, used together, then another set can be brought in, and this prevents the development of resistance. So this kind of treatment, using several of them, is called HAART, highly active antiretroviral treatment, or HAART. And many people who are HIV positive live on HAART continuously, and will do so probably for the rest of their lives. And this treatment has such a high impact that it can reduce the viral load. Testing with RNA, the testing for the viral RNA, it is undetectable in their bloodstream. That is hugely important, because it means, first, there is no impact on the immune system. The virus is not damaging the immune system. But second, they aren't infectious. And that's one of the things which has contributed to the decreasing incidence of AIDS in the population. Unfortunately, it has not had that high an impact on the infection rate. And the reason for that is that people have forgotten. People have forgotten about HIV. And people are still exposing themselves to other people who have forgotten about HIV. But the virus is still there, and is still out there. If you are sexually active, you need to be aware of the fact that the virus is out there. and that you have to be aware of it. You have to be thinking about what you're doing and taking precautions as need be. In people who have several partners, especially, they are people who really should be thinking about taking really serious precautions. And there's, fortunately now, there is a very good strategy, quite apart from safe sex and everything else. There's a set of preparations called PrEP, pre-exposure prophylaxis. And these are low-dose protease inhibitors. Usually people take once a day, a pill a day, and it actually prevents infection. Very, very highly effective, very highly effective. It's really recommended for anybody who is sexually active and who especially has multiple partners, or who has sex with people who have multiple partners. But that pre-exposure prophylaxis is widely available through health clinics, et cetera, very safe and extremely effective. Apart from that, of course, avoiding risky behavior is the next most important thing. Okay, so on that note, I say bye-bye until Wednesday. I hope you all had a very good Thanksgiving. And now, on just for the next couple of weeks, once there's our next class, we'll begin talking about bacterial disease.